Good morning, Mariana. Good to
Good
see you.
morning. Nice to see you.
So this is a long time coming. Over the past few years, we had planned a course and then we did a web-based course and you've been to Houston years ago to talk about this and other things with our study club. So I'm so excited to have you coming back to Houston December 2nd and 3rd for I think a course that displays your and my passion for perio-orthodontics. Certainly yourself as a perio-orthodontist, someone that's really dedicated so much passion to the research and evolution of orthopedics in dentistry and in this concept of mid-face palatal expansion. This course truly, I think, is going to offer something unique to the students. You know, I'm going to pass it off to you and have you tell me what you're most passionate about, what you feel is kind of the highlights of this course. But first, for me, I think it's the first course that I know of that's really tying together the importance of diagnosis and treatment planning for sure, but then starting with the midface and then letting that guide us towards the treatment plan throughout for that individual, whether they're a child, an adolescent, or an adult. And then these unique treatment modalities or innovations that we've been involved with. I know that we're both in George's textbook here coming out next year. Yours focuses on midface palatal expansion, I believe, or midface skeletal expansion, and mine is more on SFOT, surgically facilitated orthodontic therapy, but with a digital influence, meaning using digital technologies to guide us on the treatment planning through with the interdisciplinary teams. So that's, for me, that's kind of my highlight, is this course is going to tie all that together and give orthodontist, periodontist, airway focused dentist, myofunctional therapists, oral maxillofacial surgeons, whoever is in prosthodontist, restorative dentist, anybody on that team, it's going to give them, I think, a critical update on where we are with these technologies. So again, thank you for joining me this morning to give us kind of a highlight of our upcoming course. But also, let's start off with that. Let's just kind of talk about, you know, where you are with this and what you think is the highlights of this upcoming course. And, you know, also, you know, kind of where do we go from here? What's next with research and collaboration to drive this home?
Thank you so much for having me again at your study club. And this is actually very special for me because this is my first hands-on course after COVID. Since COVID, I did a lot of online education on MSE, non-surgical expansion. So for me, it's nice to end the year with in-person course, and of course in Houston. I think a lot has changed since the first time I started to use, for example, Moon MSE expander in 2017. And a lot has changed in my protocol since I started to use TED-assisted expansion in 2008. And the highlight of my part of the course will be expansion in adults, especially adult males. Now we have a lot of options to customize the treatment utilizing 3D printing technology. And I think I have noticed, like from different posts online, that a lot of doctors are really relying on the lab in terms of planning the case and implant placement in particular, and planning the design of the device. So it's actually becoming a little bit more challenging as we use it seems like the digital technology and 3D printing allows us to simplify the process, but actually it's becoming more technique sensitive and more communication sensitive, because you have to be able to communicate to the lab what exactly this particular case needs. And if you have a lot of patients that are going through this treatment, it becomes challenging because you want to make sure that every case goes perfectly and you have the best outcome in terms of achieving expansion. So my course is going to focus on the new level of expanding males without surgery, for example, utilizing multiple implants, utilizing digital technology to 3D printing technology to customize appliance for adults that have a very challenging anatomy. We also will talk about children because this 3D printing technology is now can be used in kids, in younger children, like 3-4-year-olds. We have successfully expanded children in the primary dentition, achieving more skeletal expansion, less dental tapping. And we have been doing this for adolescent patients for a very long time. And we have some modifications in the protocols, but the biggest changes that we have been doing is actually in adults, being able to expand very predictably adult females without surgery, without piezo, and also taking it to the next level in expanding adult males older than 25 without surgery, and in a lot of cases without utilizing piezo surgeon. So very excited.
Awesome. It is. In our practice, just like you in this interdisciplinary team, what it does, I think, is it strengthens these innovative therapies that a lot of people are still thinking are fringe, right? They're thinking that they're not real. They're only for the experts, but that's not true. If the interdisciplinary team looks at the CAT scan, looks at the patient, brings everybody to the table that needs to partake, i.e. the myofunctional therapist is sometimes critical in these cases to get the patient prepared for the increased volume in the palatal region, to maybe release the tongue at the appropriate time to accommodate that space, and just all the different components of this treatment planning, I think, is making dentistry stronger. And as we create more and more evidence, that's really, really exciting that the periodontist, the orthodontist, and the whole team can bring something predictable to our patients to better offer treatments that are less invasive. And if we intervene quickly enough, that's why I think it's so critical that you do talk about the adolescent patient, that if we intervene earlier with a 4-year-old versus an 8-year-old, or an 8-year-old versus a 12-year-old, or a 12-year-old versus an 18-year-old, and so on and so forth, that we can potentially change the whole dynamic of their individual patient care and lower morbidity and increased predictability. And that, I think that's really what drives this for me, is that, I don't want to put myself out of business, but, to be able to treat a child before all this happens, and maybe they won't need SFOT or soft tissue grafting because we intervened early enough. And the same goes for, maybe they won't need orthognathic surgery if we intervene early enough. So that's super exciting for me, and I'm sure you too, right?
Absolutely, yes. And I think I am very excited to have SFOT as part of it, because treating adult patients with previous history of orthodontic treatment, and also with very thin periodontal phenotype, it's very challenging. And I think combining a skeletal correction together with bone augmentation, learning about the latest advances in periodontal regenerative therapy together is so exciting. I'm also very excited to expand the orthopedic expansion therapies to periodontists. Usually periodontist deals with complications of orthodontic treatment, covering gingival receded roots, covering dehiscences in the bone, and obviously extracting, placing implants. So now the procedure of skeletal non-surgical expansion is actually entering periodontal field, because it doesn't have to be done only by an oral surgeon or orthodontist. It can actually be very successfully, predictably done by a periodontist. So I think this course will be excellent for the periodontal specialist that wants to learn about skeletal expansion, and also innovations in the bone augmentation and soft tissue augmentation from you.
Yeah, and I think that the best evidence consensus, just published, really kind of gives us that strong evidence based of how, the approach we take, right? That all materials aren't created equal. The more challenging the patient, more challenging the defect, perhaps we need other innovations to make our regeneration more predictable. And that's right off the press, so to say.
Absolutely, yeah. The exciting part about a skeletal expansion in adult is that I think when you talk to an orthodontist, they are very, I would say, conservative in terms of offering surgical, not only orthodontic surgical options, but also periodontal surgical options to the patients, unless they already see complications. So I feel that not enough patients are being referred to a periodontist for this SFOT, bone and soft tissue augmentation to prevent future gingival recession after orthodontic intervention. But now with the skeletal expansion, I think SFOT is going to be more accepted by an orthodontist, because I think if you expand the basal structure of the maxilla, of the midface, you have the opportunity to more center the teeth, the roots of the teeth in the alveolar ridge, and
Yes.
you may limit that SFOT to, instead of doing the whole arch, to just anterior teeth or just mandibular dentation. So I think
funny you say that.
we are going into less invasive direction. And I think there is a place for SFOT, there is a place for skeletal expansion. And with the proper diagnosis, we have the opportunity today to use all these innovations in a less invasive way, doing less surgery. So I think this is a very big part that we will be discussing and talking about in the course.
Yeah, I mean, that's really the best way to close this, is really the two of us as people that are immersed in research and education on peri-regeneration, skeletal expansion, SFOT, that this is an exciting time to do what we do. And the more dentists we can have come along and understand the opportunity in front of us, we're gonna treat patients better, less invasively, but still provide outstanding, stable outcomes. You know, the other thing that I'm going to touch on briefly in my part is the digital platform, that the digital treatment planning softwares that we use to import all these digital files and have a Zoom meeting between, you know, the periodontist, the orthodontist, oral maxillofacial surgeon, the restorative dentist, and sit down and talk about the options and why we're going to just do palatal expansion and only SFOT in the mandible, and you know, that if the palatal expansion doesn't work, then the patient already has a consult with the oral surgeon for dome technique, or they know up front that unfortunately you're probably still looking at a jaw surgery because of the severity of their situation. All these elements can be discussed ahead of surgery, ahead of treatment, so that there's this unbelievable ability to provide informed consent, just like what we used to do with guided surgery for implants, right? We thought that was a game changer when we could show them a Simplant plan and that this is what we're going to do. And yes, we're going to be close to the sinus or nerve, and therefore you see this, you know this, and when it happens, then, you know, the liability issue is taken care of. I see that same thing happening now with facially generated treatment planning. The things we've learned from—
That's exactly what is happening.
Right.
And it's actually even more exciting, because now it's not just the communication between a restorative and a dentist and a periodontist or oral surgeon. It's a communication between a restorative dentist, orthodontist, periodontist, oral surgeon. I think it's just, and even sleep specialist.
Yes,
because now all these services, we have more and more evidence coming out that there is a benefit to patients with airway issues, with obstructive sleep apnea, with upper airway resistance syndrome. And I think we are expanding the team to the medical providers, to the allergy specialists, to the ENTs, to the sleep specialists. So I think this is very exciting time in the interdisciplinary planning and care.
Yes, super excited. I mean, to take those philosophies of Frank Spear and John Kois and Rick Robley on facially generated treatment planning, now actually putting it into softwares to simulate those things. I mean, what an awesome time to be doing what we do, to simulate all the things we do ahead of time, having a surgical dress rehearsal, so to say, It gives the surgeon more confidence, the patient, the other dentist. Everybody has a higher level of confidence before we start these cases. And quite honestly, you got to be frank. This is a revenue generator, right? So if you're doing these things at this level and you're one of the few people in your community that are doing it, trust me, we're booked out a long time to see these cases. And that's the financial side of this, is that if you modernize your practice and differentiate yourself with these innovations, you're also going to secure your opportunity to practice as you wish to practice. So yeah, super excited about December 2nd and 3rd in Houston at the Institute of Houston Dental Synergy, a learning institute brought together with 7 dentists in Houston, all believing that education could become something next level with hands-on. We're going to be using a live patient to do MARPI. We're going to have some pig jaw SFOT. We're going to have a cadaver dissection by some oral surgeons, periodontists. And so I think the 2 days is going to be a fantastic opportunity. Join us. We got a few spots left. We're trying to hold it down to 20. So there's a couple spots left, and that's all on our website, which you can just, you're obviously seeing this recording delayed. The website's www.ihdsce.com. Check it out and come hang out with Mariana and I. We're looking forward to having you in Houston. Can't wait to see you live, Mariana.
Thank you so much. One more question, Todd. Are you, a lot of doctors that want to take the course are asking if they will be able to learn to utilize piezo, and the answer is yes on my end.
Yes.
What about, and I think the periodontist is the best person to learn from to use piezo, because we have been using it for implants, for sinus lifts for a very long time. So I think
yes.
you will have a setup, right, for Saturday too.
We're going to have 10 piezos here, complements of piezo dental to work with the pig jaws and cadaver if you wish. We're not going to have multiple cadaver specimens just because of the cost. And in the past, we've done this, and a lot of people just don't want to work on the cadaver. So, but you will have access to work on the cadaver. You certainly will have the ability to witness how we use piezo, both myself and the oral maxillofacial surgeon. And Mariana is right. We kind of wrote the textbook on this. So it's coming from experts that used how to implement piezo surgery into these other avenues of care. But we still use high-speed rotary too for certain things. So I think you're going to get the full gamut of what we use, what tools, what biomaterials we use to get the job done.
Excellent.
Great question. Yeah. Awesome. Well, good. We'll see you soon. Thank you. Thank you. Thank you so much. It's going to be a lot of fun and coming up here quick. I guess we got less than 30 days. So have a great Thanksgiving, and we'll see you here in less than a month.
Thank you so much again for organizing it, and I'm looking forward to December.
Yeah, me too. Thanks
See
so
you
much.
guys December 2nd and 3rd.
All right. See you.
See you. Bye.